been talking about quite a lot of medical and NHS-related issues this evening, to some extent by chance, but let's talk about some of the issues we've discussed, and importantly, Strep A, which is why we originally asked Dr. Fari Ahmad from the Wilmslow Health Centre in Cheshire to come in, and she's here. Thank you so much for coming in. If we can rewind 5 minutes or so back to the A&E situation, I mean, how worrying is that for you as a GP, and how much pressure are you and your colleagues under?
So it is, it's horrifying, isn't it? Like 12 hours sitting, waiting in a trolley for a bed. And, it's part of the pressure the whole system is under. It feels like it's broken, doesn't it? People who are needing hospital beds need to get there, and they're frail and they've got other conditions, which get worse waiting on a trolley for a bed. From our side, so we're seeing patients who've got a condition that they do need to go to A&E for, and they leave. They leave untreated, half-treated. They're coming down to see us. I had a child who'd had a head injury, and the mum was saying, I don't have 7 hours to go and wait. And I was saying, look, you do. He's really unwell. I'm worried about him. Can you please take him? It's causing problems, on all sides, the pressure to get people into a place where they can be safe and cared for.
And that's all because, as we were saying, they can't come out of the other end when they're, in many cases, medically fit. There's nowhere for them to go if they're not able to go home and look after themselves.
Yeah. So, there is a crisis in social care. That's not new.
No, it's
not. It's been brewing for a long time. This was predictable. Nothing's really happened about it.
And I don't want to take you into political areas because it's not fair, because we haven't talked about it, but the government have said they're going to give more money to the NHS. The autumn statement, the mini budget, whatever it was called, they said the NHS was the thing they were going to... Does it need more money still?
So, let's go right back to pre-pandemic. The NHS was funded at a much lower rate than any other comparable country in Europe. So we didn't start in a great place. The pandemic really hammered us. We were not in a great place, and we're in a much worse place now. And then, we've had, all the other things happening, like the Strep A, and you can see the effect of that. And, more money, yes, but, you're trying to fix this. You should have repaired the roof when we had the time. And it is in a really critical stage now, and it's people's lives.
And just a final, very quick one before we talk about Strep A. Are your patients able to get an appointment to see you? Because that's the one thing people always say, I can't get in to see the GP, so they go to A&E.
Yeah. So this is something that we've heard again, where we are. I mean, we've worked really hard. We've changed things. So most people do get to see us, or they get a reply, or they get in. I think 85% of our appointments were face-to-face, because that's what people want. We're fortunate because we've managed to have enough GPs. That's not the case all over the country. The number of GPs has dropped, and the number of people needing to see a GP has gone up. So, you can't spread that any further. And you have all sorts of the government saying, no, we've got more GPs. They're counting GPs in training who can't, they need supervision. So if you look at the number of appointments we've delivered, we're now at pre-pandemic levels. But
let's talk about Strep A. People we'll talk about the symptoms that parents should look out for in a minute. Tell me about the difference between scarlet fever, which people will hear about, and this thing Strep A that people are worried about.
So Strep A, Streptococcus, is the name of a bacteria, and it can live on people's bodies and noses and usually cause no harm. Now, what happens is sometimes it causes the infection, and that's one of those that we recognise is scarlet fever. So it was called scarlet fever because you'd get a rash which was red, and that's one of the signs we look out for, like a sandpaper rash. If you do have those signs, then it's, you probably need to speak to somebody, get an assessment, and see if you need some treatment or some antibiotics.
And is that in the first case calling 111 or ringing your GP if it's daytime hours?
Yeah, so I think it would be sensible to speak to 111. The problem is this time of year, everybody's got, there's colds, there's the flu is around, COVID is still around. So people are getting sore throats, people are getting flu-y, and sometimes it's hard to work out whether it is Strep A or not.
So just for parents who are watching, just finally, just tell us those key symptoms that they should look out for.
So if you've got, the main symptoms are a sore throat, swollen glands, people can get, we call it a strawberry tongue, so the tongue looks like a strawberry. It's this rash, so you get tiny little bumps. It feels a little bit like sandpaper. You can get a little bit of muscle pain with it, and a high fever. When you get worried, so if your children, or if they're struggling with their breathing, if they're going blue, if they're not behaving as they normally do, a bit floppy, you do need urgent medical help then.
Thank you so much for coming in. Really grateful. We covered a lot of ground there, didn't we, in 4 minutes? Dr. Fari Ahmad, thank you very much indeed. Thank you.